Welcome to episode 10 of One Question, where we explore the elephant in the room connected with the work we bring to the world. These are conversations about the misperceptions people have with our work, sometimes from the conversations we have in our own head, what we've been taught, or societal norms. I'm Stephanie McAuliffe, your host, founder of The Way of the Diamond Warrior, an energy alchemist and trauma-informed business strategist, guiding leaders to build a business that's a reflection of their soul. Today, we're joined by Dr. Ailina Ismail. It's so good to have you here.
Thanks, Stephanie. Thanks for having me. Hi, everyone.
So, Dr. Ailina is a functional medicine doctor with over 30 years of clinical experience, specializing in autoimmune conditions, fatigue, brain fog, and complex chronic symptoms. She combines conventional medical training with a root cause approach to help people uncover what standard testing often misses, with a focus on the gut, immune system, hormones, and nervous systems. I am so excited for our conversation today.
Thanks, Stephanie. I'm excited.
Yeah, Ailina, tell us more about the work you do and what is the elephant in the room, the misperception you'd like to take a bite out of today regarding this important work you bring to the world.
So I'm in Melbourne, Australia, across the world from you guys. Basically, I'm a functional medicine doctor and I work with helping people make sense of symptoms, right? That don't yet have clear answers on paper. Now, I don't just look at labels. Like, when you get diagnosed, yes, we need a label so then we can do something about it. But I'm more interested in what came before it, like what caused the symptoms, what's happening like upstream rather than showing up when it's now downstream, right? And for me, the elephant in the room is the being told that your tests are normal doesn't mean you're well. So I get a lot of people, they say they've got all these symptoms and then they come to me and then they say, oh, my practitioner said my tests are normal, then I must be fine, but I'm not fine, because that's simply not true.
And what I find very interesting being mired in healthcare here in the US is that most of the time, doctors don't want to deal with anything ahead of time. So they're not proactive, it's reactive. And do you find the same thing in Australia and with the clients you work with? What's one of the biggest things, what their biggest complaints and the biggest things that you see with them?
To answer the first bit, it's like you can't blame doctors in a way because that's how we were taught in medical school, right? Conventional medicine is about diagnosing, finding what's wrong, put a label on it, and then here's a pill for an ill, right? So it's all this. It's changing a bit. There's so much research out there about functional medicine, about the optimum levels that we use in blood work. But the truth is, it takes about 17 years from when there's research for it to get converted to conventional medicine practice. And we got no time. We can't wait for that, right? So I see a lot of people that come to me and say, I've got this fatigue. The most common things would be things like fatigue. Some people get diagnosed with chronic fatigue syndrome. And then I say, and then what? They're like, don't know. That's my diagnosis. No one's helping me after that. Then there's chronic pain. So it just doesn't have to be like crazy pain. It's just body aches. And then the huge one also is brain fog, right? Just forgetting things, can't remember things. These are things that don't feel normal to you, but when your blood results come back normal, and when I get that, I say, show me your blood results, right? I don't, it's not that I don't trust them. They're probably working from the reference range, which is what your labs give you, but that doesn't mean it's the optimal range. So I like to look at blood work myself because your story tells me what's been going on towards like your history, but we need to look at blood work two to look at the details, and then we kind of mesh things together, and that's when we look at, oh, this is what's going on. Does that answer your question?
It does. And do you also work with your clients in like lifestyle and some of the other things because stress can be a huge factor?
Oh,
Diet
definitely.
can be a huge, it's all
Oh,
because it's all connected.
yep, yep. So we look at the body as a whole. I've always got this, I call it a pyramid of dysfunction. And at the base of the pyramid, there's four major things. It's trauma. So we know trauma is huge. Childhood trauma, domestic violence, anything that you haven't had closure with, we got to address it, right? Then there's stress. And stress, there's 7 different types of stress. Everyone always thinks of mental stress, but there's physiological stress, spiritual stress, creative stress. And you need to look at all of that because some people come to me and they want to work with, because I do a lot of autoimmune work, and the most common autoimmune disease is Hashimoto's, which is a thyroid problem. And they come to me, oh, just look at my thyroid function and I'll be fine. I'm like, no, we got to look at the base of the pyramid. So the stress and then the sleep. If you're not sleeping, then your body can't heal, your body can't recover. And then it just becomes like a vicious cycle. And then there's relationships, how you interact with people around you, your community, people that you work with, and nutrition. Nutrition is huge. The gut is huge. Whatever gets into our body is basically through our gut. So it's what we eat, what we drink. And yes, sometimes bad things get our body when we cut our skin, but that's not common, or we inhale a foreign body, which is rare. So it's usually what's the nutrition that we're feeding ourselves that then goes into our gut. And then the gut then talks to everyone else, like every other organ in our body, right? So that's important. And the last one is movement, right?
Mm.
And if you follow me, I do some, like, I love exercise. It's like part of my life, but not everyone can do what I do. But doesn't have to be that. You can just start with walking, even just walking to your mailbox at the front, and coming back if you're just crashing in the middle of the day. So there's all these things that you can do, but it has to be personalized to you to make it work and not it'll be too hard. Right.
And
Yes.
one of the things I find fascinating is the National Institute of Health and the CDC here in the States have done massive studies in and around adverse childhood experiences
Yeah.
and the long-term effects on our health. One of the things I don't hear a lot of people talk about, and as an energy healer and someone who experienced a lot of trauma more than anybody should ever experience, one of the things I don't see a lot of people talk about is the effects of having to swallow our emotions on our gut health. So I'd love to hear your thoughts on that.
So we do know there's a very strong connection between the brain and the gut, right? So how I explain it to people is there's this the biggest nerve in our body, the longest nerve is the vagus nerve, and 90% of the time the gut talks to the brain, and 10% of the time brain talks to the gut. And that's through the vagus nerve, because the vagus nerve starts in your brain and it touches mostly all of your other organs. And we talk a lot about doing vagus nerve work because that's your rest and digest. That's the opposite to your flight and fight, right? The sympathetic nervous system. Okay, so we know the vagus nerve is important and we know it connects the brain and gut. It's like when you say you're anxious and you've got butterflies in your stomach, or the other way around is when someone questions why you decide that to do something and then you say, oh, it's just a gut feeling. So that's the main brain gut connection. And we know trauma is huge that affects mentally your mental health. And of course, I don't do the work with trauma when I just try to explore if they have a traumatic issue, then I refer out because can't do everything. But let's just to have that sense and knowledge that, oh, that might be one of the root causes of how you present physically, right? Psychosomatic. So The question was about the gut. Yes, when we, what do you say? Swallow.
Swallowing our emotions because so
Yep.
many
Yeah.
are silenced and
Yep.
we don't
Yep.
have a space to talk about our
Yeah.
emotions, our experiences, even though May is Mental Health Awareness Month.
Yep.
And yet there's a very small opening of the window for us to actually talk about our experiences. So when we don't have that space, it's
Interesting because I come from an Asian background. I was born in Malaysia. Um, and we never talk about that. I I knew mom had major depression and anxiety, but no, it's taboo, right? You never go on happy pills because that's not a thing. Like it's that means that you're crazy. So that's my background. And then I come to Australia and we are starting to talk about it. Like we're talking more about it, but there's still so much that we can do, right? Yes, you're right. We suppress a lot of things, and that's what is one of the main root causes that we have to go back to and address it. I think it's society. Society plays a role, like a role. Like if you look at what social media is doing now, they're showing most of the good stuff. Like everyone's happy, rich, doing out, traveling. But all this, and some people do share the negative, like the things that they're struggling with, but mostly it's all the good things. So what are all our younger generation looking up to? Like, oh, life must be good. Why am I depressed, anxious? It must be me. It must be something wrong with me. And if I can't find the right people to talk to and discuss things, I keep it in because everyone else around me looks really happy and everything's going really well, right? So yes, over here too, it's mental health. We call it in May, we call it "Are you okay?" Is that the same over there? That's the caption we use
oh,
because
okay.
yeah, "Are you okay?" Yeah.
Nice.
Um, my gym is actually doing like a walk. We call it the walk around Australia. So we're donating money and we're just clocking in how many kilometers we do, and we're trying to get at least a lot of work charity for our organization here. Does that
Nice.
answer your
And
question? I
yeah,
kind of like to
I
ramble on.
I love your statement though of just being told that your test results are normal doesn't mean you're well. There's so many aspects of this. And it's interesting too in that I see some traditional doctors here think of functional medicine as kind of woo. So I'd love to
Oh,
hear
I
your
get that all the
thoughts on
time.
that because it's not. I
No.
have friends here who are in integrative medicine and functional medicine. And when I was going through breast cancer, I worked with a naturopath. And working with her probably is part of the reason why I'm alive today. So
Mm.
I'd love to hear your thoughts on this because it's not woo. I actually think you're getting deeper into the details than sometimes traditional allopathic medicine can go.
So it's all about research, right? We go based on research. It's not, yeah. Um, so I do, when I get my clients, my patients, I say to them, hey, you're going to see your cardiologist, you're going to see the conventional specialist. You might go back to your other GP because they come to me for functional, but they go back to their general practitioner. I said, so I don't want you to get confused. So I set that expectations. I say, okay, we know that, for example, a certain cholesterol lowering drug can long-term cause side effects. And there are already lawsuits with that. So then I say, hey, in conventional medicine, as soon as you get a heart attack, you're put on this high dose cholesterol lowering medication because we assume that it's the cholesterol that's the bad cholesterol is blocking your heart. So then I say, okay, I'm going to reduce that. We'll keep an eye on it. So we're not just reducing or stopping it and not looking at blood work. We work on your lifestyle, and then we retest in 3 months. But if you go back to your cardiologist, just be aware that he or she might see it differently. Because I get love letters all the time from specialists, other specialists. But I say it's okay. Like if you want to have a chat with me, I can bring out the data. That's not a problem. So yes, but not every client I meet, because I wear two hats. So I'm a normal conventional practitioner, GP, and as also the functional because Some people just come to me and they want a script. They don't want to hear about moving more, eating better, eating more proteins compared to carbs and all that. They don't want to hear that. So you can't help everyone, right? I mean, when I started functional medicine, I came back and I was like, verbal diarrhea. I was telling everyone, you gotta do this, you gotta do this. And I realized that some people, it's just too hard for them. They don't want to listen. So I just work with those people that really want to change their life. They want to look at root causes, and then we go from there.
Yeah, and some people do want just a pill, and that's okay. That's their choice.
Yeah,
It's their free
yeah,
will. And yet,
yeah,
it's functional and allopathic medicine, just like your practice, isn't, they aren't mutually exclusive.
yeah.
And I
I
think
think
that
there's a place for conventional too, right? Like if you've got a
absolutely
heart attack, if you've got a raging infection, if you don't get drugs, you're gonna die. Yeah.
right.
No
Well,
amount of vitamin D will have a heart attack.
yeah,
Right?
and that's what I mean by the allopathic conventional.
Yep. Yeah.
Absolutely. And I think working with them in partnership can be a beautiful, beautiful thing. So you have, for the listeners, a free guide for people who feel dismissed, confused, or unheard when their symptoms persist despite quote unquote normal test results. And it's you're not imagining it, how to advocate for your health when you're told everything is normal. And the link for that will be down below in the notes. Are there any final thoughts you'd like to share with the listeners as we wrap up?
Well, a lot of people come to me and say, there's something wrong with me, but everyone thinks it's normal and they think it's just in my head. They want me to go on a- antidepressants. I call them happy pills. Um, but you have to advocate for your own health, right? If you feel that something's not right, if it's affecting your quality of life, right? Your everyday to day life, it's like you're not functioning the best that you can. You don't need to wait until something shows up in the test, right? Because in functional medicine, we have like an optimum range, which is still within the healthy range that conventional labs have. But our range is smaller, tighter. And then when we get out of that, we start to see yellow flags, red flags, and we do things before it gets to the disease state, right? Because by then it's harder. We can still work on it, but it'll be harder. So your body communicates early, it gives you symptoms, right? So listen to your body, trust your body, because that's where everything begins. You, as I said, you advocate for your own health. And when you learn to do that well, and there'll be some tips in my guide, then you can advocate for other people that you love, right? Your partner, your kids, parents, friends around you. So you are not imagining it. When you do have symptoms, you have to work your way through and ask the right questions and, fight for what's right for you.
As I say to my clients as well, listen to and trust your body. It's speaking to us all the
Yeah.
time.
Yep.
Ailina, thank you so much for your time today. And yeah, everybody who's listening, get this guide because we need to be our own best advocate. And it begins with speaking up and listening.
Thanks, everyone. Thanks, Stephanie, for having me. It's been a pleasure.
Thank you.